There's some key factors in recuperating from liposuction. The first and most important is to follow the directions that your surgeon provides to you. So this involves eating a healthy diet, and in those days following surgery, it means making sure that you're getting enough protein and iron, because there's a blood loss associated with liposuction, which is what lowers the hemoglobin and makes you feel lightheaded. I did experience some shortness of breath. At first I didn't know what it was. I was walking, because one of the things that you really need to make sure that you do after liposuction is to get up and walk. Not hard, not far, but just get up and walk every couple of hours. And so every hour I was out in an RV park, I would get up and I would walk down the hill and then back up the hill. And I started noticing that I was kind of experiencing some shortness of breath. And then I realized that that was because of my hemoglobin being lower than what was normal for me. So I had to make sure that I didn't walk alone, that you always take somebody with you, you always have somebody with you, especially in those first 24 hours. That's key, because you think you are fine. I thought I could drive. When we pulled our RV into the RV park, they had to take the keys out of the ignition, because my tendency was I was going to get it straightened out. I was going to be the one who made it right. And I thought I was perfectly capable of doing that, but the reality is that you're not. So a caregiver is a very important part of the recovery process. I can't speak for everyone, so my story is different than a lot of people's stories. I did not experience any medical issues post-lipedema. I went back to work the next week. I walked every day, several times a day. I kept myself hydrated. I didn't struggle with that. I know a lot of people experience the struggle with keeping hydrated. My biggest post-liposuction event was the swelling that occurred at day 8 through 10, I'm going to say, was at its maximum level. And I reached out to the women who had preceded me in surgery, and they had said, just keep your arms moving, flap your arms, move your legs, try to keep the blood flowing and the lymphatics flowing. And I did that, wore the compression faithfully every single day, and the wraps as prescribed. I went for 1 solid month with not only compression garment on that went from the middle of my foot all the way up to my chest, but I also wore the Velcro wraps on my legs for the full 6 weeks that was recommended. It's hard. I'm not gonna kid you about that. I live in San Antonio. It's hot. And even in January and February, we can get some really warm weather. The next big issue I had was itching, and I just kept reminding myself that itching meant that I was healing. And I soaked in Epsom baths, and when I took my compression off for that 1 glorious hour every day, I would put my legs up in the air and scratch the living daylights out of them without breaking the skin, and pat them and slap them to make them feel better, and then wrap them back up. And other than that, I really did not experience any difficulty. My recommendation, if you're going back to work, is to make sure that your coworkers know that you're recovering from surgery. My coworkers were extraordinarily supportive and helped me carry a hassock type thing to put under my desk so I could keep my feet elevated all day if I was at my desk. When it got to the point where I could take the wraps off, I still wore them. I would wear them to work in the mornings for my commute where my legs were hanging down. I would take them off if I had a business appointment to go to. I'd put them back on when I got back in my office. And they actually provided me with comfort. You actually get to where compression is a part of your comfort zone. I am a 1 year post-op patient, and today I have compression on, and I wear it every single day of my life, at least for 8 hours a day. I don't sleep in it any longer. And when I'm swimming, obviously I don't wear my compression, but if I'm up and moving around, I have it on, and it provides a level of support and reassurance that I'm doing everything within my power to keep lipedema from returning in my body. Dr. Byrd has emphasized 3 things. One is eating a clean, healthy, low carbohydrate diet. One is walking, getting your body moving, keeping the lymphatic system moving and flowing throughout your legs. And the third is compression. And if I have to wear compression for the rest of my life, to me, personally, it's a small price to pay in order to be able to wear boots and jeans and dresses that come above my knee and keep me from hiding the way I spent the last 30 years of my life.